Just so everyone's aware, Miss Catherine is en route. She will be a little bit late. With that said, Mr. Blythe, would you lead us in flag salute, Mr. Gordon in invocation? Sure.
You'd please place your right hand over your heart, or if you are a veteran or active service, you may salute the greatest flag of the world. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For those of you who care to remain standing, Heavenly Father, we're so grateful that you are here amongst us to help the district make decisions and choices that would better the delivery of healthcare in our community. We just ask that you be with Catherine on her drive through the canyon. We're so grateful for all the water and the snow that we have around the valley. The lake is filling it. And Father, just bless this meeting in Jesus' name. Amen.
Good means do we have any changes to the agenda as presented? You would like to have any changes?
Okay, let's see, that's the agenda.
The agenda itself.
Okay. What's not on there? Okay, I just want to correct the minutes on the meeting that I was on, the personal.
Personnel policy.
Yeah,
Okay.
We'll do that under consent.
okay.
Because that's a consent item.
Yes.
Okay. All right. Mission statement is here for all to read. But public comment, do we have anyone from the public that wishes to make a statement on something that's on the agenda?
I have nothing that's on the agenda. I just have something to say when you guys are finished with all you gotta take care
Okay.
This is actually their time.
Okay. Would you like to make a statement, please?
of. Yes, I wanted to,
Can you state your name, please?
Martha Adams.
Thank you.
I came in here, August 14th. And, some things transpired that, I thought that you guys needed to be made aware of. I had come in, after drinking something that had been in my refrigerator that I was not aware of, and thinking it was thought of alcohol. I had been out looking for my husband, who was riding a motorcycle, saying, "Please come get me, I'm exhausted," and he was in Barstow. So I had been looking and looking. Unbeknownst to me, they'd already had Flight for Life take him to Loma Linda. But by the time I got home, I was just a nervous wreck. And I went to my refrigerator to look for something to drink, just a shot of alcohol. And there was something in there in one of those little shot things that like they have at the Shell, just the one shooters. And I shot that, drank it. It turned out not to be alcohol. It was something else that somebody else had left in my refrigerator, but I was unaware of. And I knew I was in trouble immediately. And I got into my car and I drove here. And I don't remember many things, but as I walked in the door late that night, I told the security guard at the door, "Please, dear God, help me. I have drank something. It's got to be poisonous. It could be this, or this. Just get me some charcoal, please, right away. I'm terrified." And I lost it right after that. I have no recall of anything until after September 20th. And somebody that had been in the hospital that knew me and heard what was starting to transpire recorded it just so I would know how I was being treated. And I have that recording if you would like to hear how I was treated when I got in here. I specifically, that's the last thing I said, "Please, dear God, give me some charcoal," because I knew something was eating my stomach up. So, I have the recording if you guys would like to listen to it.
May I say something? If it was a recording in the ER,
You know,
may I suggest that you meet with the CEO and Fred or someone
okay,
apart from a public meeting and you can play just
that's
because,
even better. That'd be great.
yeah, just-
Your lawyer?
I am the lawyer. But because for other people's privacy concerns, we
Yeah,
don't want
I
to play
understand.
recordings that come from the
Totally
patient
understand.
care area. But we do want to hear your concerns.
Okay.
Bring a lawyer with us anytime?
No, you don't have to.
No, he's not saying anything about that.
No.
It's privacy between the one person who needs to. He just wait.
Right
and
after
we'll
the-
finish.
After the meeting, maybe.
Forgive me, if you like, after the meeting, I'll be glad to sit down with you, take it further if you wish,
And I'll meet with them as well.
if that's okay with you.
I couldn't hear you because she was talking.
Forgive me.
I
I'm
was
saying
sorry.
after the meeting, would you like us to meet with you further?
Yeah.
Yeah, that would be fine.
Okay, I'll be glad to do so.
Okay, in fact, I can go right outside and wait for y'all, so y'all can take care of whatever you need to.
No, this
It's
is,
it's a public meeting. You can stay as long as you want. It's okay.
yes. It takes,
It could take.
it could take a couple of hours.
Okay, that's fine, thank you.
Thank you. Okay. All
I just
right,
don't want
I understand.
other
Thank you,
patient
Scott.
information.
Yes. All right. Moving on to consent agenda.
Okay.
Following items are considered routine and non-controversial by hospital staff. We have any changes to consent
Yes,
as such?
on the board personnel and policy, we had a discussion about the max minimum wage, $25.
Okay,
It's pretty long, and at the meeting, Dave agreed to do a report,
okay,
and you agreed, and there's nothing about it in the minutes,
in the minutes themselves,
right?
okay,
And also we discussed the hospital relicensing. And we also agreed that meeting, that wasn't the meeting to discuss it at. It's like it was gonna be discussed there and then go away.
Okay.
The full public needed to be aware of it, and we discussed that we would talk about it at the board meeting.
Okay.
This meeting. And there's nothing about that in there, so the minutes doesn't reflect what was said and done. They weren't put in there. I don't know how they got not put in.
to the adjustments to the minutes specifically on. Obviously, we have the minimum wage increase, which I captured,
Which there was an agreement to do a report to see how it would affect us specifically in that.
okay,
And then the discussion of the relicensing was supposed to be at the board meeting. It should have been, there was no discussion at all about us discussing it. And we had a long discussion about it.
and none of that was in there.
We're going to be discussing it. So at this point, it's
All right.
probably a moot point, but the report, as long as Dave agrees that he's going to be doing it, because according to the minutes, there isn't, you don't need to do it.
Dave, are you okay?
I've spent quite a bit of time looking at the numbers and
Okay,
I'm prepared to make a presentation on it. I apologize for not getting it on the
Well,
agenda.
no.
it doesn't have to.
No, it wasn't you.
Prepare that report for,
Yeah, no problem.
I'm not complaining about
Thank you.
anything. Okay,
okay,
so
beyond that,
that's it.
all right, do we have any other items or things we need to handle for the consent?
Do I have to abstain for not being at the board meeting last month? Okay.
If not, $5. If not, can we get a motion on consent? So moved. Second,
I'll second.
Mr. Parks, your vote?
Yes,
Mr. Ross?
Yes.
Mr. Blake?
Yes.
I'm a yes.
You know what?
What?
You can just do voice votes now. You have everyone here in person,
No, I don't. Catherine's not here.
but she's not online.
That's true. I'll still do them individually.
That's fine. It just occurred to me as you were doing that.
Yeah.
that I have to- No, someone was online.
All right,
No one's on.
let's jump to the foundation reports. Ms. Haft?
Good afternoon. I don't have a lot for the foundation other than everyone knows that we had to cancel the Heart Walk and we moved it to April 15th. Hopefully we'll have much better weather by then. And do you have any questions regarding foundation?
No.
Okay, then I'll move on to the auxiliary. The auxiliary, they were closed due to illness and weather this past month for February. However, they did bring in just a little over $8,000.
Fantastic.
Any questions?
Good job.
That's my request.
Thank you. Dr. Finstead, medical staff?
Yeah, thank you, Fred. I would be on video, except the video camera is not working on this computer that I'm in Dr. Gross's office. Anyway, Infection Control Committee met on January 18th and reviewed their usual reports, including hospital-acquired infections and blood culture analysis, active surveillance of MRSA, hand hygiene and Foley catheter usage, along with infection control assessment and the pharmacy biological sampling. The Antimicrobial Stewardship Committee met on January 31st and decided to discontinue an old policy. This was regarding penicillin allergy testing. We had developed a policy, but it never got off the ground. We never had implemented a program to start this. And then when Dr. Filizarda joined staff and became chairman of the advisor of the Antimicrobial Stewardship Committee, they decided not to move forward with that. They also reviewed policies regarding management of asymptomatic bacteria, management of acute urinary tract infections, along with the appropriate antibiotic selection. And then also they approved a policy regarding dosing of aminoglycosides along with the appropriate monitoring. This is an older class of antibiotics. We don't really use it hardly any anymore. Have better, less toxic medications, but it's still available if need be. And then they reviewed their regular reports, including the antibiogram, which shows which bacteria are sensitive to which antibiotics in our facility. Also reviewed antibiotic usage for pneumonia and lower respiratory tract infections and urinary tract infections. And then they reviewed the pharmacy environment of care rounds. Pharmacy and Therapeutics Committee met February 15 and approved a number of policies regarding, most of these were related to laboratory and respiratory therapy, and then the above mentioned policies from antibiotic stewardship. Also reviewed a formulary request. We need some more information. That's been tabled till the next meeting. We reviewed our regular reports regarding blood usage and blood culture analysis, Foley catheters, and hand hygiene. And then finally, the Med Exec Committee met February 13th, reviewed and approved the one reappointment credential file on today's agenda. Also approved the above mentioned policies, and then reviewed some COVID issues along with regular reports, including procedural sedation, mortality reviews, and we had recently gotten 2 coroner reports, which are in the process of being reviewed and discussed in MedExec. And unless there's any questions, that's the extent of my report.
Any questions, sir?
Yeah, Dr. Finstead, this is Ross. You had mentioned that one of the antimicrobial stewardship programs, there was some initiative that we started and it wasn't going to go forward. Could you explain that again?
Sure. So a lot of people come into the emergency room and into acute care, and they will list a penicillin allergy as something that pertains to them. There is a policy that is approved by the CDC on how to go about testing these people for that. The reason for that is this. When we use antibiotics other than penicillin for an infection, if penicillin is appropriate or a derivative thereof, the other antibiotics have a broader spectrum of action. So they target more bacteria that we don't really want to target. So if we can use a penicillin antibiotic that has a narrower spectrum of action, we are able to treat the infection and cause less basically collateral damage.
Okay.
But Dr. Filizardo felt that this was a new thing. We had not been doing this. He felt that he didn't really want us to move forward with that. And I can't really give you any other ideas about his reasoning other than to say that's what I had, the report I received from that committee.
Okay. Well, I guess
I
my
can expound
underlying,
a little bit if you'd like.
my underlying question is,
Okay.
does it run afoul of anything we promised the CDPH that we would do?
No.
Okay. All right.
No, and I would agree with Mark. This is really just related to the antimicrobial stewardship, trying to improve our practices, but he did not feel that we needed to really head in that direction.
Okay. I'll take his word for it.
Yeah.
Thank you. Any other questions for Dr. Fenstead? No. Okay.
Okay, great. Thank you.
Chief Executive Officer report, Mr. McGlue.
Sure, thank you. I went live this morning with our new retail pharmacy software, QS1. This has been a lot of work that's gone into that will significantly improve operations within the pharmacy from an efficiency perspective, and elsewise our ability to make sure that we are collecting the cash we're supposed to and so forth. And will also provide us some expansion of services that will allow us to really get into the full-blown curbside pickup, as well as drug distribution to homes and drug delivery program and so forth, because it's got the charging mechanisms built in to allow us to do that. So that just went live this morning. They're a team of 2 people that came out from QS1 that are actually down there with the staff, kind of watching them as they go live with all the new prescriptions and so forth. All of the existing patient data that we had in our old system was transferred over this last week and so forth. And they spent all weekend here going through and making sure that was all up to speed and accurate and so forth. And so, and that went apparently without a hitch. So that's in place. We're glad to hear that. Like I said, they've been working on, we had 2 systems that we were working on the installation of. The second was our new HR system. That is progressing well towards implementation. We will begin testing that system using actual employee data here shortly. Or we started, you guys started that yet or not?
We've not tested it. We're just in it.
Okay. And so we're still working towards a go live date of March 26th for that system, where we'll be actually the employees will begin clocking into that system and so forth. And so again, that's been another one that's been a lot of work, just getting the new policy and procedures all updated for HR, make sure they were consistent with how we were doing things and so forth. So it's all been a part of that. So I'll keep you apprised as we go forward on that one. We had a meeting, Bob and I, with the floodplain manager and the assistant director for Kern County Public Works to review our compliance options for the building down the street. And obtaining a building permit. The conclusion was that we can meet compliance by installing a flood barrier across each of the back doors of the building. So I've got actually a picture here. That's what it looks like. It's basically a 3-foot metal paper that you drop into a slot that's on the door just to prevent the water from crashing through the door. And stuff like that. The buildings are stucco, so they said that meets compliance, so we don't have to go in and do any other waterproofing or anything like we did on the clinic building over here. So that's it. So Bob has reached out to the architect. They gave us several companies that installed these. The architects reviewed those and he picked out which one he thought would work the best. He's incorporating those into the plans. Those plans will be finished, I believe, and resubmitted by next Tuesday at the latest. And so forth when we move forward from there, hopefully. So
How do people get in?
this is only, the only time you have to put those in is when you expect a major flood. So this is, otherwise you storm in the building someplace in the closet. That's
Whose job is it in the organization to determine when it's gonna flood?
that would be facilities. We'll do that.
Well, I know if everybody thinks everybody else is taking care of it, somebody would.
No, it'll be facilities. That would be an upgrade we have to do.
Okay,
to the building.
okay,
So
well,
it's just, you just drop them in the plane. That's it. So, so anyway, so that's where we're at with that.
okay, can I ask you, the prescription drugs,
Yes.
the B coverage, which we can't currently bill, will that computer make it easier to do that? It's really, really important.
Yes. Yeah, this
Okay, well,
is full blown system.
okay.
That doesn't do anything.
Cool, thank you.
So. That's why they've been trying so hard to get this thing in place. Anyway, I received notice that we have a QIP check, which is basically an IGT thing, but for quality programs that we can pick up tomorrow morning from Current Health Systems. Gonna be a little over $1 million. So yeah, they're starting to come through. So figured you'd be pleased to hear that. Absolutely. I signed it on.
Is it cash? Can I pick it up?
No, they only release it to me. I signed a non-binding letter of intent to contract for healthcare and hospital services for members of the new plan. It's called Champion Health Plan of California. They're currently applying to CMS for approval as a Medicare Advantage chronic special needs plan for individuals with end-stage renal disease. The intent is to basically negotiate an agreement with them before January 1st, 2024. And so in other words, they have patients up here with a number of patients up here with end-stage renal disease who are going to be in need of emergency services, potentially SNF services and so forth. And then they need a contract, obviously, they need to be able to demonstrate to the state and to the feds that they have contracts, hospitals and providers and so forth up there. So we're moving forward with that as well, just to kind of expand our plan coverages and so forth. We have a new bill, AB 977 from Rodriguez. He's a representative on the assembly from Chino, who is sponsoring a bill to make it a crime to commit assault and battery against physicians and nurses and other healthcare workers in hospital emergency departments. Currently, there's already a law that prevents anyone from assault and battery against first line responders, such as fire department or paramedics or whatever. It didn't apply to hospital personnel. This one will extend that coverage, and it's basically a 1 year in jail and up to $2,000 fine or both. And so that one's got a lot of support from obviously from the hospitals to put that in place. So we're going to be actively supporting that regulation. There's another one that's coming through that 968, I believe it was, that again allows for us to continue the provision for hiring physicians. And so we run a program that allowed critical access hospitals to hire physicians. And so this will make that permanent and so forth. So that one is expected to go through as well. It's got a lot of support on both sides of the aisle. One thing I'm not real happy to report, but again, I certainly understand circumstances. And Sarah, our HR manager, is going to be leaving us, unfortunately, moving to North Dakota to be with her husband and so forth. So certainly appreciate that. And again, she's been helping a lot, obviously, with the new HR system going in and so forth. So it's going to help us get that up and running.
What are we going to do?
Well, we're in the process of recruiting, to find a replacement as well. So we've been advertising for that already.
When did you say she's leaving?
April 3rd, I'll be here April 3rd.
So again, we appreciate her help
You can't be replaced. Somebody else can get in your place. So I guess.
And then just the last thing I have are two things, no, last thing, the state is currently working on a draft of a new plan or a requirement to basically discontinue masking in hospitals and healthcare personnel. They were supposed to release it Friday, and it's going to be contingent upon what's going on with COVID or other infectious diseases within the community. And as long as you've got a relatively low rate, then you don't have to wear the mask, except in other areas where you have a patient who might have an infectious disease process going on, or surgeries or things like that. So I think everybody is desperately waiting to see. And so we're communicating with Bryn Kerrigan from Kern County Public Health. And she's been actually on the phone with CDPH and a number of the other counties helping to write that new regulation. So should be out any day now. So like I said, they were told by CDPH it would be out Friday and did not come out. So maybe later today or whatever, we'll wait and see. But it looks like we're finally getting to the end of the mask mandates for a while. Here's my report.
Thank you. Any questions, Tom? Gene?
Staying busy, nope.
John? Okay. Thank you, Tom.
You're welcome.
Mr. Gordon?
Okay, so according to, just to kind of dovetail off what Tim was talking about, according to the state of California, we have come through the pandemic and no longer have to worry about COVID-19. But apparently it's not pandemic, it's endemic. So it's going to be with us, just like the common cold, flu. We have, so far in March, we've had 2 cases only. So our positivity rate is 1 point. It's like 2%, I think, right now. So as long as we're less than 3%, we shouldn't have to wear masks, but that's my own opinion.
What about the shots?
That's another thing that
Oh,
they're
yeah.
planning on doing away with is vaccinations. They're not going to require the vaccinations for.
So I don't have to catch up on the ones I missed.
I'll give you yours personally.
He's good. He's done my book. No pain.
Okay, next thing I had is the transportation service continues to grow and we're developing policies for the operation. We did have 188 transports and they only worked about 17 days. We did have to cancel 2 days due to the weather. That meant we had at least 15 and perhaps 18 cancellations because of that. So the weather really hindered us in February. The next thing, the CNA class is scheduled to begin early in April. We're thinking of ways to improve the attrition rates. I think I reported that similar to that net, but they've been going through their interviews, and Sarah and Joy and Ben, who is going to be the new instructor, I think he's going to be really dynamite in that role. So we're excited to see how that first class comes out. I think, how many do you have already, Sarah?
27 applicants.
Wow.
And out of those 27, we've kind of narrowed 4. We're not going to make it. And then the other ones, we are going to be making a choice today, whether they're going to be in the first class or in the September class.
Yeah. That's
Phone
great.
call to let all the applicants know we'll be going out today and tomorrow.
Did they hear about that $25 minimum wage? Is that why they're applying?
Yeah, perhaps. So the next thing, we have a couple of surgical consultants who have come up to help get our nurses who are in the OR helping with surgeries competency trained and tested and adequately trained to be performing back there. Because our surgery service has been kind of on hold for a period of time, people get rusty and they get. So we have entered into these agreements. It's going to be a 3-month program. They're going to be working on getting our policies back there up to date and all of our services, CDPH worthy, I suppose, and not to mention patient worthy. So we're excited about those 2 consultants. And the last one I had was Assembly Bill number 40. Another one presented by Assembly Member Rodriguez. This has to do with patient offload times. Ross, you might be interested in this. Our patient offload times in Kern County are pretty pretty bad in the bigger part of the city. Adventist Health has a pretty high rate. For Kern Valley Healthcare District, we had 1.14 patients that didn't get offloaded within 20 minutes.
Within an hour.
Within an
That's
hour.
an hour, yeah.
Yeah, right, okay. So what that means is what's happening in Bakersfield is the ERs are so jam-packed that if an ambulance brings a patient to the ER, they don't get to offload that patient for up to 319 minutes. Wow. So that's an incredible number. So this assembly bill would require those facilities to put in measures to ensure that the patient offload times are less than 20 minutes over 90% of their visits.
Is there a priority on the people that's waiting? Because a lot of people will take and they just use the emergency room as a doctor. So they'll call an ambulance. And
They're certainly going to have to address how they're taking care of patients in the ER.
Yeah.
So those ones that are clinic visits should be just triaged and medical screening exam and then sent home and with an instruction to go see a primary care physician. A lot of times we have compassion, we have that need to treat them for whatever they show up for. And frankly, I
But the
think
real
we are
ones with a
part of the
heart
problem.
attack or something,
They don't have a bed to lie in.
yeah.
Well,
That's
those
the problem.
are still triage though.
They get triaged, but if there's no beds available, they're sitting on it. They might get triaged and treated right there on the ambulance gurney while two paramedics are sitting there standing by to take care of them. So
What's the penalty for non-compliance?
that's a good question.
Yeah.
I didn't read the whole assembly.
Okay.
Just the part in yellow. So, yeah. And actually, this bill actually is asking the authority to provide technical assistance and funding as needed. So this is a funded mandate that he's asking.
Interesting.
For the rurals, yeah.
For the rural.
Yeah.
So it's an interesting concept.
So the large, so just so everybody knows, the underlying issue here is that the large metropolitan hospitals are basically relying on the ambulance staff to take care of the patients because they don't have the appropriate number of staff to do the job. Whether it's intentional to save money or they just can't hire them, depends on the situation, I suppose, but their burden to take care of those patients is shifted to the ambulance companies, and the ambulance companies aren't getting paid for it. So it's a way for the hospitals to save money. And so this hopefully will put a stop to it.
Yeah. See, our biggest problem with patient offload times at our facility is that we have 7 beds. And if I have an 8th patient come in, where am I going to put them? And frankly, the transfers down the hill are occupying those beds waiting to be transported. So I don't have any place to send those to clear those beds to get.
Well, and the other thing it does too is that it primarily ties those ambulances to that hospital and takes them out of service for other emergent care that
They
needs to
can't
be
respond.
rendered.
They're
Right.
not available.
Exactly.
The hospitals down there use the hallways.
Yep.
There's not a room. So can we use some other area? You said there's 7 beds. Could we?
Oh, we
use
have them in the
an acute
hallway. We've
bed?
had them in the hallway.
We have them in the hallway.
Okay.
That's,
Or
we
an
just
acute
do
bed
what
or
we
something.
can with what we have.
But we could do something.
Right. Like I said, our patient offload time, we only failed to meet this within an hour offload time, 1 out of 1.14. We don't have that.
There's no issue here.
Typically.
Right now, there's not. If the politics change and things happen.
I think if this changes, because now all those hospital employee or all those ambulance people are now going to be occupying beds in the ERs down there, it'll be worse for us as far as transfers is concerned.
Transferring out.
Well, yeah, because like I said, a lot of it hasn't been staff availability. And so now if the staff is obviously got to take that patient responsibility and let these guys go after 20 minutes,
Right.
then it's going to be a long time before they round around through those other patients and so forth. So it's going to be a disaster, I think, for a lot of those.
Wasn't there a time whenever we had a real problem with somehow or other Bakersfield was able to not do what they're supposed to and everybody came here? We got upside down. It's been a few years back.
We had a time where, we had 2 or 3 ambulances showing up and waiting here, while we're trying to get patients in bed. A lot of it, like I said, is because there was no place to transport you down there, that they were full. So they couldn't transport down the hill.
Many times we're calling outside of area, Las Vegas, LA, San Francisco, Fresno. We're calling all over the place to get transports out of here. Utah, yeah. We've sent people up to Reno.
Yeah. Remember that.
So
On December 30th, at Memorial Hospital, I was a patient in the ER. Got admitted, triaged, and they had me sit outside on the outside bench for a good 12, 15 hours. There was no space. I was an ER patient sitting outside on the bench.
12, 15 hours.
Yeah.
Wow.
Did they know who you were? Did they not like?
Don't think they cared.
Maybe they did know you were.
So there is a real problem with bed space in Kern County and all over apparently. So not to mention that more and more people, nursing staff, doctors, they're all leaving the healthcare industry. They just don't want to be part of healthcare. Yeah. So it's a huge problem.
It's a big problem.
And that's my report.
Mark, I have one question. Side transportation services to Bakersfield. How are we coming along?
We're doing.
Going well.
Yeah, it's cool.
I'm sorry, when there's rocks in the can.
Well, it's kind of hard to fit the Kia between the space of a
boulder
Mini Cooper. So we canceled transports for those kinds of things.
Of course.
That's transport. It's not like emergency,
No, they're not.
We're not interfering with liberty.
Not at all. No.
Okay,
Any other questions?
no, that they seem to be, are they working with us, Liberty? We don't talk about them. I don't know if this is, they seem to be working with us.
No,
At
we
least
don't
when I'm a
have anything to do with
patient,
Liberty, not with these patients, no.
We're just referring to the transport.
I know, and I was also asking if we have an issue with Liberty.
Not really, no.
Okay, cool. That was my own question.
Just really.
I have a pretty good rapport with their chief over there, so we discuss issues sometimes, but
Good.
as far as having a problem with Liberty, no.
They seem to have a good attitude.
Some of them do.
Yeah.
John, any questions?
No.
Thank you, sir.
Thanks.
Mr. Cooper.
Thank you. So I'm debating whether to address Gene's issue first as old business related to the proposed assembly bill to increase minimum wages for healthcare workers. The existing minimum wage is $15.50, and the bill, the new number on the bill is up to $25 will be the minimum wage for all healthcare workers. So if we were to have to implement that, there's a couple different ways you can look at it. If we made the assumption, which I don't agree with, that all we had to do was increase those folks that are on the very bottom that are below the $25, that would equate to now what I also had to do is I also had to look at the impact financially between now and when we finish our construction project, which is about 5 years from now. So the compounding impact of that increase on salaries, because they're not paying for it. They're not telling us that there's going to be any increase in Medicaid or Medicare payments. That alone is which I would call the best case scenario in terms of the lowest impact on our bottom line in terms of how much cash is available for that project is 3.5 million.
So now take away 3.5 million.
3.5 million less in the bank to pay for our, and we already know that we're probably going to fall a little bit short of that 34 million number based on our most recent projections. So that would put us even farther in the hole. But I don't even buy into the fact that those are the only people that would be adjusted, because we're going to have to increase everyone else to have the equivalent internal equity such that there's compression was what they called it. And I overheard it was at the county, when they increase the percentage, the increased minimum wage, everybody else gets that same percentage or something close
The
to that?
minimum wage goes up.
Yeah,
What the percentage
So-
going up.
They usually address,
so.
maybe not immediately, but over time, yeah.
So the huge number, if you're gonna look at it from that perspective, the difference between the existing minimum wage of $15.50 and $25 is 61% increase. So now what organization can afford to increase their pay of their people by 61%?
IGT would help some, right?
Yeah, but now all of a sudden, we're talking about 15, 20, $25 million. And it would just, I mean, and we're in a good position. There are a lot of hospitals already on the edge that would immediately, within 6 months, go belly up. So I'm not thinking it has a whole lot of chance for survival, just because the other hospitals are screaming even louder than we are that we just can't do it.
What's the chances? Who knows? Does anybody, Tim?
My guess is it's not gonna pass. I think there's so many cases that would be made by hospitals throughout. I mean, not even just small hospitals like us, big hospitals.
It's got its good side. If everybody would be in the same boat, and as the boat rise, we would all be in it.
But
If
you
we
gotta
did,
be able
that's
to
a
pay
very
for it. That's the
positive
problem.
thing.
You gotta be able to pay for that.
Well,
There's no
if
additional-
everybody's in the same boat, the money will have to come from patients or the,
The state doesn't pay an increase in Medi-Cal in 10 years, or even longer than that. So, they don't seem to care that our costs go up every year. So we can't count on that, I mean, I don't disagree. I think everybody in this room would love to be able to pay people more money,
It'd be great to
It
be
helps
first
attract
in
people.
line to be able to get the best people out there because
Yeah, right.
healthcare pays the greatest.
Yeah.
It's hard to disagree with that.
Right.
It's a concept.
Right.
Well, and the other issue is, you just mentioned so many people are leaving the healthcare industry. So how do you account for that? I've been a patient at Cedar Sinai several times this last year. They're even shorthanded.
Yeah, right.
So where do you find the balance?
People are
of all
leaving
that?
the industry and it's like I said, now maybe an increase of that magnitude might cost people to take a second look.
It might help. And it could even help the doctors if they were working with people that were.
Yeah, it has to be a total program from the perspective of you've got to have the offsetting revenue coming in to cover it. And that's just, like I said, the health plans aren't designed. I mean, you guys work with health plans.
At least we looked at what could happen,
Yeah.
basically.
Yeah, so it would be extremely difficult for us to manage our cash flow needs if we were to have to implement that program.
But we actually could do it if it happened sooner than later.
But not ongoing. We could do it for a little while.
Yeah, but
Not
again,
ongoing.
as soon as you increase somebody's
But
wage,
we're-
it's not like you take it away the next year.
Yeah.
We're in the same shift as everybody else, so it has to balance out.
It's-
Even insurance companies said that they weren't.
I propose Gene and Fred up there in sugar.
So
Already raised rates everywhere else.
I know, I'm being facetious.
we're gonna do the finance report old fashioned. You guys are all here. I'm all here. So I'm just gonna
Thank you
talk.
so much for doing that. I
You
didn't
bet.
know you had it
Yeah,
with that.
yeah, it was not a problem.
Before we leave that, Tim and I had talked about this. One approach that we might want to take with this bill is actually support it. With support if amended, the amendments being one, state you pay for half
Oh, I see.
seismic.
Funded, right.
And two, you increase your Medicare or Medi-Cal expenses enough to offset this cost. Then we'll be on board with it. Great.
Yeah, absolutely. We'd love to be first in line to get all the best employees.
Yeah.
I would support that.
Yeah, that way there's no harm to us. Our employees benefit from it. And we're getting paid for it.
I could get a part-time job here.
The legislature is so driven by the labor unions. Conceivably, this could be approved by the
Right,
legislature.
right.
Hopefully, the governor would veto it, but there's no guarantee that either. And they don't make decisions logically in Sacramento.
Yeah.
They base their decisions on other factors, and
One of
what
the
the
things,
unions want is one thing. So if we got on board and say, okay, let's talk turkey, this is really what it's going to take, then maybe they'd pick it up and run with it.
this is, the unions have taken an interesting strategy. Instead of going after the whole state, they went after cities. They went after LA, they went after Duarte, they went after a couple of other cities further south. and up north. And in all but one case, the hospital association was able to convince them to table those or turn down those efforts by the unions. They wouldn't even consider a bill or a proposal to do that. So one city apparently did decide to do that, and they're waiting now to see what the impacts are going to be for that hospital in that town. So like I said, it has the potential to put a lot of hospitals out of business.
Yeah.
And so
There are hospitals already on board.
Or put them where they belong. With
the way it's
more
written
money,
right
with
now,
more
it would
money.
put them out of business. Yeah. So
There would be some corrections made, Tim, to bring the whole industry up. That, I don't,
They
I
wouldn't
don't
move
sound like
they
a
wouldn't move
union.
fast enough. There'd be so many hospitals closed and the chances of them reopening by the time Sacramento acted.
Maybe an emergency fund along with what you're talking about.
Maybe.
Sharing, yeah.
So we're gonna go to your packet, go to page 20.
Okay.
And I'm just gonna refer to one graph real briefly, then we're gonna go on to the P and L. So the acute days was the main story of the month for January. The graph, the third graph down on the left side, acute days. You can see the number for the far right bar, 158 days was our best acute days over the last year. So that really helped our overall bottom line because the acute is a big, high revenue, high profitable part of our business. So moving quickly over to page 23, that equates favorably to line item number 1. You can see that number of 1,864,000 actual 160 compared to the budget, $250,000 better than budget on the inpatient revenue. That's the acute days was the contributor for that. Last year, if you want to look at the whole, so the bottom line for the current year, I mean, for just the month of January is right below line 34, total net surplus, 385,495. So this is the first month of the year that we actually beat budget by 50,167. And if you go to the far right on total net surplus, you can see last year's January, we actually lost 43,000. So we can feel really good about the performance in January, especially when considering the very bottom line, line 39, that we still haven't gotten the IGT payments in. You can see the number in the actual column, 499,628. A year ago, there was 3.5 million came in January. So we're way behind in terms of cash. What the normal way we get IGT payments in, it's taking longer this year than it has in prior years, but we still plan on a catch up at the end of the year. But in the meantime, it's showing less and less cash on our bank statements until we get that IGT money.
Is that 1 million you're picking up tomorrow?
That's part of that 7. Yeah, eventually we're still expecting about 9 million, but right now it's less than $1 million.
welcome, it's coming. At least we know a lot of it is coming in March. So some point here.
So keep in mind, we had a very aggressive budget for this year. And if you go to page 24, you can see after 7 months, our budget is total net surplus at the very bottom below line 34, 2,325,000. Well, we're not there. We're at 1,449,000. So we're about 876,000 behind a very hard to achieve budget because we put the budget together knowing that it would be a challenge for us to do every year and have enough money for our projects. So we really wanted to push our departments to perform better in order to be successful of our other project of getting our long-term goals met in terms of still having money in the bank and being able to afford the construction project. The same trends are there. in terms of the low amount of IGTs for the full year. And the other interesting is line item 28. If you look at our actual year-to-date total expenses, 19,290,000 compared to budget, we missed it by 1642. So we're all pleased that
Your finance the other day.
we are able to technically accurately project, 16 million in expenses and hit it head on. It's amazing. So I always worry about the first year I do a budget in an organization, but we hit it pretty close so far this year. So
Star on that one, Dave.
So yeah, I should, as soon as you say something like that, then something goes wrong. So anyway, we're in good shape for the year, even though it's not quite up to budget. What'll really make or break us is this ERC program. That's also taking a little bit more time. But if that hits, that'll be an extra close to $3 million. And that'll for sure, push us over budget once that money comes in. So that's my financial report. If there's any questions or comments?
Gene, any question?
No, thank you for, I didn't expect you to have that quick.
No, not a problem. It's an interesting topic to wonder how, if we can pull that off and have hospitals pay appropriately our people, because clearly it's not, when they make that choice, do I want to work at this kind of environment or this kind of, there probably needs to be a premium paid for people to go into the type of environment that they have to go into now for hospitals.
They deserve more. This is almost like a war zone. You don't know what you're gonna get when you come in, and so they deserve more money.
Yeah.
Ms. Shirley?
No questions. Thanks.
Sean?
No,
Scott?
No questions.
Thank you, Dave.
thank you. Dave.
Apologies for being late.
Oh,
Glad
thank
you're
you for being here.
Nice seeing you in person. All five of us are for the first time.
I'm not kidding.
There's another $5. No new business, old business listed, forgive me, new business. Resolution 2304. This can be one page. Okay, we're on page 43. We have some equipment that we need to get off of our books. There's a list of that on page 44. And this is our, we have an EKG machines, I believe. This is the one from the clinic. Is that correct, Greg? We also have the radiology equipment, our old RNF unit in back here that is beyond repair. I mean, we haven't used that thing in a couple of years now. And also this is the X-ray equipment over in Dr. Leho's building. We're pulling out of there because that's where we're going to be putting our new map.
That's not on the resolution.
Oh, that's true. That's not a part of the resolution. We're taking it out. I'll get to that in a minute. We are going to take that out, but the bottom line is, we need to get this stuff off of our books, and we've cleared that with finance and so forth. And I believe most of this stuff has been adequately depreciated. There's, obviously you can read the list here. Most of the stuff is radiology equipment that's in that trailer. The Konica Minolta CR readers, the cassettes, the fluoro tubes, the upright Bucky's, Fuji processors, the whole bit, and so forth. And then there was also an avian transport ventilator with case on there that was purchased back in 2006. Needs to be retired as well.
Can I make a motion to accept that resolution or the way it's presented by Tim, by his recommendation?
You need me to read the resolution or no? No. Yeah, second.
I'll second.
Is there a market for this stuff, or we're just gonna?
Doesn't sound like it.
Beyond use.
Okay.
Question I have on it, is any of that considered hazardous materials in today's role when disposing of this stuff? Yes, and the company that we're proposing to do that with is experienced in doing that. Okay, we take care of all that. Thank you.
There's nothing the thrift store could do, right?
No, don't think so. John, what's your vote on this?
Yes.
Ross?
Yes.
Yes.
Ms. Kathy?
Yes.
I mean, thank you. You're welcome. Item number 2,
is the quote for to have the equipment removed. We did find a company. Bob looked around trying to find someone that would be willing to come up here and get that stuff for us. Not a lot of places willing to do that. And so this actual place is coming up out of LA. It's $11,000 to remove all of that, handle the processing, repackaging, get rid of the tube, the whole bit. For this one, as well as the unit over Dr. Lito's, it's a small little X-ray unit over there that he had. And so forth, which I guess that's the site where we're hoping to be able to put the mammo unit that we're moving forward on. So I need board approval to go ahead.
I make a motion, we do the same thing in this.
I just have one question.
Sure.
Will we get documentation from that state it's been handled properly for disposal?
We will get that.
Thank you.
We will include that.
Thank you, John. Brilliant. Yes. No,
Yes.
yes. I'm sorry. Is there any public comment from anyone? Because I'm failing to bring that up. That's why I have Scott here.
I don't even know if anyone's online.
No. Forget it.
That's okay. Yes.
Yeah, I knew that. Thank you.
Since it's being recorded.
Yes. All right. Yes, sir. Brown.
All right, so since the declared state of emergency expired on February 28th, we are back to, well, first of all, AB 361, which waives certain portions of the Brown Act for board meetings. It's no longer in effect. We are back to the general Brown Act rules for remote meetings, except that the legislature has added a new provision for holding board meeting or for directors appearing remotely at a board meeting in an emergency situation or where there is just cause. So the standard rule is that a director appearing remotely has to put their address on the agenda. They have to post the agenda at that location. It has to be available to the public. And 3 directors have to attend the meeting from within the district, not at one location, but just within the district. So that is your standard Brown Act rule for appearing remotely at a meeting. If there's a situation, and usually this arises after an agenda has been posted, which is why it's an emergency situation. But if you have a situation where you cannot attend in person, and you have to attend remotely, and it qualifies as an emergency situation, which is a defined term, is in the memo I sent you, or you have just cause, which is also a defined term in the memo that I sent you, then the board can approve the participation by that director remotely. But 3 directors have to be physically present in person at the location on the agenda. So in your case, here at the boardroom. All right, so those are the changes. So if a situation arises, an emergency situation arises, and someone in your family becomes sick and you have to care for them, the agenda hasn't been posted, then you can say, hey, I need to appear remotely. Board would vote, find the emergency situation exists, and then you could do that. All right. So those are the 2 rules for appearing remotely. If we go back into a state of emergency where social distancing is recommended, AB 361 does not expire until 2024. So we can always go back to AB 361. But in 2024, that rule ends. Okay, so I put in there the definitions. Emergency is just cause.
So Scott, a remote attendance, somebody like me, I'm not a director, obviously. It's just, it doesn't matter.
It does not matter for anyone else. This is only the board members. And then there was a new provision regarding public documents. You guys are pretty good about getting the documents for the board in the agenda packet that's posted 72 hours ahead of time. There are some agencies that are not as good as you guys. And so we have a new rule about how you if there's a document that's going to be available after that 72 hours, the process you have to go through to make it available to the public. So that's just a little blurb.
What is the process?
First, the agenda has to be made available at the district's office for inspection by the public. Or you can do 4 steps here. A staff report or summary of that agenda item was included in the agenda packet that was posted 72 hours before the meeting. So that way the public knows there's no document, but this is the topic.
Something, yeah.
Yeah, so summarizing. You take that document and you post it on the district's website. Okay, and it has to be clear that it is applying to that agenda.
This is website, so how would it be identified there? I mean,
So this is the way, the statute doesn't say,
okay,
but what I think agencies should do is at the site where they post the agenda, they post the document with that agenda. To me, that makes the most
Okay.
sense and makes it clearest to the public that these documents are related to this meeting. Your website has to be listed on your agendas, so the public knows where to go to look for that document. And then physical copies are made available for public inspection at the district office.
if it didn't get out Friday and we got it Monday, 2 hours before the meeting, could we address that at that point to go ahead and add that document?
So the rule for adding items to the agenda
Well,
was
no,
not
not a
modified.
new agenda, documents for the thing that's on the agenda.
So you don't get so if it, in that case, you would make it available at the district office. This
So
would,
2
this is
hours.
my
okay,
advice.
Okay,
Make it available at the district office and post it on the website.
okay. Even though it's short notice, it's still there. Okay,
Yes.
okay. All right.
And we'll see how this plays out. Right? This,
Well, we couldn't make a mistake
well, you haven't.
being us.
So you guys are good. So anyway, so those are the general rules. Catherine and I had a test run today with how that works. Unfortunately, I was not able to accommodate her, and I apologize for that.
That's okay. My car speeds.
And the canyon was open.
Canyon was open
Wherever
and
you came from?
beautiful.
Yeah.
Absolutely. Yeah.
So, and then did you have a Brown Act question?
No, I got that addressed.
Very good.
I appreciate it.
So that is, are there any questions? That's all I have in terms of these.
Well, my question
Changes, yeah.
is the physical copies. Is it 24 hours before the meeting?
I'm gonna look at that.
Okay.
The old rule is 24 hours after the meeting. It was next business day. So I'm gonna look at
Which
that.
would make more sense.
Yes, it would.
So, okay.
Now, this is probably for the next thing that we're gonna be, but this is not real organized and the public is not represented really good here. I mean, the way we use it, we'll probably, is there any,
Code red, ER emitting fire drill. Code red emitting fire drill. Code red, ER emitting fire drill.
as far as offering the public to come, there's not much opportunity here now. The 2 people that were here is gone, but are we gonna revert back to cheers for the public the way it used to be? Are you?
Well, so you have to have the place open to the public. So I think if you
Accommodate.
start getting public attending the meetings, then yeah, you'll need to accommodate them. Right? You can't make them stand or whatever. So yeah, you'll do that. And I think that you'll probably feel that out as the meetings go on. I think one of the nice things about Zoom is that the public, like a lot of my agencies have public that are on Zoom that are at these meetings because they don't want to drive
Right.
and they want to be able to come and go as they want.
So
So,
everything just affects the board members. Everything else can stay the same. Everybody can look at us.
Yeah.
Look down at us from a Zoom up or down or even.
Thank you, Scott.
yeah,
Thank you.
it's just an
Thank you.
information item.
Yeah.
Any questions?
I have a comment.
Sir?
So Jim Park sent an email to all the board members on February 23rd. Accusing me of a Brown Act violation and demanding it be on the agenda. I'm assuming
Okay.
that's what this was about.
No, it was about what he's doing. If you want to talk about that, do you want to talk about it?
Yeah,
Okay,
you publicly accused me of violating the
Okay.
Brown Act.
okay. At that meeting, maybe you weren't, it's what I understand about the Brown Act, which probably isn't as much as Scott knows. At the meeting where you were sending text messages to the other board members and Tim. At the same meeting, about the same thing that was being talked about at the meeting. Can you do that?
What evidence do you have that I sent a text or an email to another board member during a meeting?
It's recorded. It's on there. We know.
No. Do you have the text? What evidence do you have?
I've got the word of Tim saying you were texting him.
Staff member, not another board
None
member.
of the board members. He sent it to Bob and to me, and he had told us it was from the website of the county Department of Public Works. That's where we needed to go look for the floodplain issue. That's what he said.
Okay, did you send it? I'll ask you, did you send it to another board member?
No,
Okay. Okay, sending it to the other people participating in the meeting. Is that a violation or not?
No, directors can't communicate with one another during a board meeting other than.
But
in
you
open session.
can tell other people what to do quietly on the side?
I can
The Brown
communicate
Act
with a
does not-
staff member anytime I want to.
The Brown Act does not.
All clear, code red, all clear.
So they can be having a meeting within a meeting. Them discussing stuff without board members knowing it.
So this is a meeting for the board members. And the public's interest is in hearing the discussion of the board members and how you come to the decisions you make. And what interests you're taking into consideration when you make those decisions.
But he's influencing the
direct-
decisions on what they're saying.
I'm not aware of him
Okay.
influencing their,
Well,
First of
what
all,
he
Tim
was
does not
saying
make a
was he was
decision.
talking to Tim.
my
Did-
understanding is he said, this is the person who you would contact if you go to the county. That's not a Brown Act.
No,
violation.
he said this is the person you should not invite to the meeting.
No, it's not what he said.
Is the recording, do you have the recording?
He said he was sending me the name of the person I should reach out to.
Okay,
Who's over the.
I would like to bring the recording back to the next meeting and put it out there.
So
Hold on.
if he was just saying this is who you contact, that is not a Brown Act violation.
No, that's not what he said.
That's
What
what I
did you
said.
say? You said, this is the person you do not invite to the meeting.
That's not what.
That's what you said.
I don't remember.
Is that
what
true?
I said.
Oh, I know.
Hey,
Yeah,
You asked me a question. You want the answer?
Yes.
Shut up and give me a chance to
Then-
answer.
Oh, I don't remember. That sounds like it's something I've heard before.
I've got the email. You want to read the email?
My email?
No, the one I sent to Tim and Bob. I can forward that to you if you want, as long as it's okay with Scott.
Yeah, that would be good. So, but meanwhile, that would not be,
The Brown Act does not discuss that. The Brown Act says director shall not communicate. That means you all cannot be emailing, texting, messaging each other during the
okay,
meeting.
but people in the meeting, let's like he's talking to Tim on the side,
Tim does not make decisions. The board makes decisions.
but he makes recommendations.
He may, yep.
So-
And you guys will have discussions
So
about
you're
what those
saying if-
recommendations may be.
You know, if Fred's sitting there and I'm wanting him to get a message that I want to do, but not, well, no, not Fred, because he's a board member.
Board member.
Don't include me.
So Gene, this cannot happen. A director cannot send a message to a staff member and then the staff member relays that to more than one other director, right? Two directors can always communicate. It's a quorum that constitutes a meeting.
They were talking about it at the meeting, how funny it was.
But did that
Well, it
involve
was-
all the boards?
All the board members heard it.
Did it involve the decision that you made?
Well, it was more of a joke, so in an indirect, yes, it did not. Does that make sense? Yes, we didn't.
There was no decision in front of the board to make.
Yeah, this does not sound like a Brown Act violation to me. If Ross had sent it to Tim in order to be forwarded to Fred, to go to Catherine,
Okay,
then that would
okay.
be a problem.
If you volunteered to send me the message.
But just send it to Jean.
I have more to say on this.
Okay,
So you've accused me of breaking the law, violating the Brown Act. So I want to state for the record, I did not break any law. Our attorney has confirmed this, that I've done nothing wrong. I've been subject to the Brown Act for hundreds of meetings over the past 40 years. In my career with Kern County, I attended, conducted, led, coordinated hundreds of meetings that were subject to the Brown Act. In addition, I spent 22 plus years on school boards, every meeting being subject to the Brown Act. In all, I have 40 years of experience complying with the Brown Act. Jean's misunderstanding and ignorance of the laws governing the board is really quite astonishing. You have what, 4 years experience on this? I have 10 times the experience that you do. Yet your ignorance does not stop you from making wild, false, unsubstantiated public accusations of wrongdoing about me. You could have simply called Scott in advance with a phone call or an email. Hey, express your concern to him and find out. But no, you insisted be on the agenda and made public. My reputation is very important to me. I work hard every day to maintain a good reputation. When a colleague, a fellow board member, makes a false public accusation about me, it harms my reputation. It's an act of defamation. It creates doubt in the public's mind about me, even though I have done nothing wrong. This is not the first time you've made accusations about me, about other board members, and about the administration of this district. Your actions are reckless and harmful. You seem to have a complete disregard for how your actions and words negatively affect the people you have to work with. On a personal note, I've been a longtime client of your insurance agency, and we no longer are doing business. For an insurance agent to treat his client in such a disrespectful manner is intolerable. I'm in the process of transferring my account to another agency. From a public perspective, your reckless and harmful accusations do the following. One, it betrays the public trust, the very public that was elected, that elected you to serve. Two, it creates a toxic atmosphere in this board. And three, it creates a distrust, frustration, and a difficult work environment for our administration. I can't tolerate this any longer, Jean. This level of disrespect that you show for the public, for the other board members, for our staff, and for me. Your actions, I think, make you unfit to hold this office. Your continued involvement as a member of this board is detrimental to the success of this district, and I call on you to resign. If you refuse to resign, I ask that a resolution for censure be drafted and given to the board for its consideration at our March 28th meeting. That concludes my remarks.
Tim, you made a decision on what you're talking about. Did you see the email?
It wasn't a violation, Gene.
Did you see the email?
I've not seen the email.
Okay, how can you make a decision on it then? He made a general. He didn't see the email. You can't say he made a decision.
It's a copy of a Facebook page that basically from the Kern County Public Works that said, here's the org chart for the people that are over Public Works and floodplain.
We were discussing who they should meet with. And it was Bob and Tim were going to be meeting with the county. I might be involved at some later date, up in the air. And the information that Bob provided verbally during the meeting, I could see whoever he'd spoken with gave him the wrong information. And so I sent the right information on who they should be meeting with. Period, that's it. I didn't want to take up the meeting time to talk about it. I just saw the information on the internet and sent it to them. Quick, efficient, trying not to make any waves. Simple.
Yeah, the memo that I sent is simple. It wasn't public. It was to the board members and
Whenever you send an email to every single board member, by definition, under the Brown Act, it becomes public.
well, did it go public? Is it public?
It is public because you sent it to every board member.
Okay, well,
Any member of the public can come in and ask for that, and we have to give it to them.
we
I'd
don't
like to
agree.
just make a statement, first of all, as I said, listen to this. There's been more things that happened in these meetings with people's tempers and comments to each other as board members that would, to me, cause public concern for everybody. So I take what you're saying seriously. I'm not just saying Jean or just you or me or whatever, but it's a reminder that anything any of us say to each other when our tempers rise up can be considered, a concern to the public. And I've seen it in the time I've been here amongst some people. So I just want to bring that to our attention that this is serious and it could be either any of us that someone could write a memo about. So we just need to take that seriously, I think.
It was made very clear to me in the very beginning of my tenure. I responded with a reply all. And I was corrected right from the beginning. Don't do that. This is what you have just done.
Right.
But unfortunately, it took something like that for me to understand and realize what I had done wrong.
Yeah. And I'm not just talking about the Brown Act. I'm just talking like with his comment, being those that have elected us, we need to be totally aware of that. Even though someone doesn't show up here publicly, doesn't mean they're not rewatching it or that we don't feel degraded or whatever from somebody else. I just think we all need to be.
I just think that our actions in this room and away from this room portray who we are as individuals.
Absolutely.
And we have to hold ourselves to a higher standard.
Absolutely. So I thank you for the time and consideration of you writing your statement. I mean, that's huge. I could hear it in your voice. It's hard. It's hard to treat anybody else that way for most people. And I appreciate that. Is it something I would say I would agree with or not agree with? I mean, I don't know. I haven't really put thought into it other than it just makes me more aware of how I act also to the public. So anyway, I wanted to say thanks for that.
One thing to consider. If it was you, he made the public accusation of breaking law about, how would you feel? I don't like confrontation. It makes me uncomfortable. But I don't think that this is tolerable. You got to stop it.
I don't know.
Well,
And I don't think you should be on this board
Yeah.
anymore.
I would like it to be investigated. Scott, how do we investigate it? Because what he said and what is being said, he said is not true.
Well, if it.
I
and I'm
don't
not
have any
Scott,
reason
sorry.
to believe that Ross is lying about what the email says, but I'm happy to look at it.
Okay, and you can't edit those things, right? Okay. And can we get a copy of it?
Yes, was this an email or text message?
Yeah,
Let's talk about the board minutes.
No, it's an email.
That was a email he sent us.
An email to Tim and to Bob.
I can see if I can.
What he was referring to, at least.
We'll take, I'll look at it after the meeting.
Yeah.
okay.
I can show you.
The recording of the meetings on the website if you'd like to do it.
Okay.
Shelley?
Done, thank you. But I would like that resolution brought and have the board consider it on March 28th.
Right, can you handle that? Thank you. Number 4 on new business, I brought this up because a number of us have full-time jobs in addition to what we do here. I did not know with us needing to meet in person, if we need to consider changing the meetings back to an evening to try to get more participation from the public as well. But I wanted to leave that up to the decisions of the five of us on how we move forward. Catherine, what's your input on that? What works for you?
Any evenings work.
I mean, do you prefer the afternoons? Do you prefer evenings? What best
The-
fits you
well,
in the workshop?
The afternoon on a day off is what worked better for me.
Okay.
But I only work a couple of days a week.
Okay.
And they were on, what day were they on before?
So finance committee was the one that was problematic for you.
Oh, that's the one that was paying.
Tuesday, yeah.
Yeah, the
Okay,
board meeting's on Monday, your day off.
And then Wednesday.
okay, so yeah, so that didn't do anything to affect this.
No,
Never mind. I'm good.
Okay. Which part?
I'm spaced out what we're even talking about.
We're talking about hours for the meeting. Do we
Okay,
meet it when
okay.
we're out?
Okay.
Evenings. is-
Okay, we were elected by the public to bring it, and we owe it to them to do what's best for them also. If, you know, if we can. So I think, from my experience, most of the public works. They work, they have a job. And that, or they have routines that they do. And 1 o'clock in the afternoon in the middle of the week is not a good place for the meeting like we have been having on a Monday. We had it at 6 o'clock on the first of the month forever. I think since the hospital's been here. And I think we should go back to that now that we're past COVID. And primarily, although we do have the addition of the Zoom, which is awesome. But we should at least try going back. That's my thought, the way it was. And the board members are going to have to be here according to what I read. And if I didn't read it wrong, you can only miss two meetings for cause or whatever. You gotta be pretty much available. And so it's going to be back the way it was, where you gotta show up. So I think an evening is going to be a better, or 6 or whatever. And the evenings on a consistent basis.
Are there any morning hours that would be considered early morning hours?
I'm sorry, sir.
6:30, 7 o'clock in the morning. Or something like that, before your work starts.
Doesn't matter. I was at the office today at 6.
Yeah. Well, time your door opens though, right?
No, that's correct.
Yeah, right.
Mr. Blythe, what's your opinion?
Well, my problem lately has been, every Monday I'm not usually in the lake, up here at the lake. That's why Zoom kind of accommodated me to attend meetings virtually, being down in LA, part-time now. So, and I know we changed the venue to accommodate, administration not having to go, or, have a evening meeting and go home late and whatnot, but, so that's kind of where I'm at with this. I mean, if I can't see reading the new Brown Act, provisions, being stuck in LA, and then how can I make that?
So you can always appear remotely if it's posted on the agenda.
Okay, just
Your
as long as the
address-
address is posted on the
The
agenda.
address, you post the agenda and it's available to the public.
Okay.
You can always do that if 3 other directors are appearing from within the district. And so you just need 3 in the district.
On site, yeah.
And there's no limit on that. That's not the just cause emergency situation limit
Yeah.
because it's publicly available. You can't
So
do it
as
in the
long as
car.
3 of us are available, he's got no issues.
That's right.
Okay.
That's right.
Yeah.
But you can't do it in the car.
Right.
It's not publicly available.
So sometimes that's been the situation where I have,
Yeah.
called into a board meeting in the car, but
Just leave the doors open.
I know, right,
Yeah.
right. In fact, at the last meeting when I was flying to Jamaica, I was telling Fred, I says, I actually had Wi-Fi on the plane. I could have called, from the air.
That's funny.
So true story, I'm on my way to a court hearing in Lancaster and my car breaks down on the 14.
Mhm.
And the judge was kind enough to let me call in on my phone, on the shoulder, on the 14th. It was crazy. So, yeah, so sometimes things happen,
Yeah.
right? They happen and
Yeah, this is kind of a rarity that I'm here on a Monday in town, but I do like coming to the meetings in person. I like seeing everybody and seeing the administration, and I like the one-on-one more than
Yeah,
Zoom. That's
me
just my
too.
opinion. So
Mr. Elliott.
So my schedule's pretty flexible.
yeah, you're retired.
Yeah, I think it's important for the public to have availability to attend these meetings if they want to attend. I don't think moving them to the day has prevented that, but maybe in some instances it has. And so if it's the pleasure of the majority of the board to go back to night meetings, then I'm fine with that.
Do I need to make a motion to see, or have you, is everyone,
so we can't do it
Take
today,
action.
right? Because you set your time, date and location for regular meetings by resolution.
Right.
But you can decide when you want to do it. We will do a special meeting for the April meeting. And we'll do a resolution there changing it to whenever you decide.
I think we should go back the way we were. First, what was it, Jim?
First Wednesday.
First
That's
Wednesday of the
6
month,
o'clock.
and it's 6 o'clock.
I think it was 5:30 for closed session and 6
Yeah, yeah.
or something like
It's
that.
difficult to do closed session first because we never knew how long it was gonna last.
Yeah,
So we sometimes
do
had
it
people
last.
standing out in the cold.
It'd be better for the last.
Yeah, but you also did it originally before, because didn't they have dinner? Since
Yes.
so many directors were coming from work,
Yes,
and so they didn't have time for dinner, so,
actually
We
did a
did.
5:30 start.
yeah. And everyone would eat during closed session.
Ms. Catherine, what's your opinion? Do you prefer the afternoons? Do you think the evening for public involvement? What?
I don't see any change in public involvement. I hate to say that, but even there's times where there were good. But it was when something wasn't going right.
Correct.
It's not when we're doing good. Then it was like everybody was here because there was some turmoil somewhere. And with COVID, the way it's been, I don't think people are gonna really start attending. People like to stay home. I'm beginning not to want to people, which is weird for me. But I don't know, a date and a change is gonna matter to the public. I really feel like at this point, meeting the director's needs, I hate to say that, but to do a good job, and the staff also, because there are people that's been here all day and then coming to the meetings. So to me, it really doesn't matter. If we need to go back to evenings, I am good with that.
Before you got here, we actually had public for the first time. in
Oh, we did?
years. We did, yeah.
And I missed it. Shoot, they knew I wasn't here, huh?
They're waiting for me.
I also chose not to stay for the meeting.
Yeah,
So I would recommend a day change but if you can post where you're at, if you're at the same place every Monday, that address can be posted, so that can stop, with the problem.
Yeah.
You're out of the
I
office, so,
hired personnel,
oh,
so I'm doing great.
nice.
Yeah, miracle. Only take it 2 years.
It's not a nurse, is it?
No. They needed to change careers.
Oh,
Yeah. But
so,
yeah, so I personally don't have an issue either way. I just want to be able to see the public try to get involved with the work like they do.
yeah, I
You're
would
full
too.
of them.
I would too, but as long as we're doing good, I don't think we're.
All right. I personally don't have an issue with it remaining at 1 PM at this time until we're asked to do so by the public. How's
Okay,
that?
and then we can always address it then.
Russ, that worked for you?
Yeah, absolutely. Yeah, I think it makes it more logistically beneficial for the people who prepare our packets and do all the background work to have it during their working hours. And I don't think it's a disservice to the public. I could be wrong, but I too am a member of the public, and it's available. We're available. So I think I'm good with leaving it where it is.
Okay. You the same thing, John. You'd be able to post it and be available via Zoom.
I'll try.
Try's not gonna work, yes or no?
Yeah, if we need to change the day or something, then
What works for you?
it's not Tuesday, Wednesday, or Thursday. Well, not the first Thursday, or the fourth Thursday, all the rest of the time.
What about the full moon?
I don't know, their staff are pretty busy at full moons around here. So,
Midweek honestly is better for me. I know it doesn't accommodate Catherine though.
If you did it the second Thursday,
second Thursday, yeah, I don't work.
You're in trouble now.
I mean, I know that messes up committee meetings and you have to look at all that, right?
Yes. Will we do it the first Monday now, following?
Well, apparently we're talking about Thursday,
Yeah,
We're asking, does Thursday work or what's in place? that-
whatever works for you guys, I'll make.
okay.
We're smooth other stuff around. And this is your meeting. I mean, I think that's the
I
important.
understand that, but it's everybody's meeting.
Yeah.
Because it has to work for everyone in this room.
Yeah.
Thursday would be bad for Exchange Club.
Oh, true, unless we did it after
Every one of you guys.
3 o'clock or something. Which is late in the afternoon, but I'm still before the evening.
Yeah, I don't have an issue with that. But would 3 o'clock on a Thursday, that Thursday work for you?
Yeah. They have like I said, this, I only work on the first and third Thursday.
So depending on how the calendar falls, sometimes the first Thursday is gonna be where our meeting would fall, sometimes it's gonna be the second, depending on the committee meetings. That one's difficult to juggle between our schedule and her schedule. Just depends how it cycles up.
At this point, should we carry it through to the next meeting and discuss it further after you have a chance to evaluate things?
Okay.
Does that work for you?
But you're looking for something,
Preferably
Something.
on a Thursday,
preferably a Thursday. I will see
around
what
the
we can
3
do.
p.m. range. See how that works out for your team?
But for next month, we're gonna continue with this schedule until we.
Yes,
find an
ma'am.
alternate. Okay. Perfect.
That work? Does that work for everyone at this point? Sure.
And by the way, if you find a time that works.
Yes.
And you're ready to go next month, you can just do that.
Okay.
Right, we'll just schedule, it'll be a special meeting, we'll have a resolution there and you can move forward.
Okay, good.
Yeah, it's easy enough,
That'll work.
whatever you guys want.
Okay, that was Scott. Thanks, John. Director comments, Ms. Catherine.
No comment.
Good part.
Looking forward to next meeting.
Mr. Blake.
I've said enough today.
Mr. Blake.
I don't have anything this afternoon either.
Okay. Other than that, I'm glad everyone's here. Glad to see everybody's smiling face all at one table. It's kind of nice. But,
Well, I guess that would be my comment, that it's
That would
good
be-
to be in person and see everybody.
all right. Beyond that, we'll go to closed session now. Scott?
Yeah, so in closed session, the board discussed Collins versus KVHD and gave direction to the CEO. The board also performed CEO performance evaluation. No other items were discussed in closed session.
I don't see anything further, guys. We're adjourned. Have a great day. Please be safe. And look forward to seeing everyone at the end of the month. Unless I'm on a